Hey students, so this is continuation of bioethics and healthcare situations. In other words, the specific situations that we encounter in the healthcare setting wherein we may need to apply ethics and the different principles that we have already discussed. Now, let's talk about abortion. I know you are very familiar of abortion, and since you are level 2 students, you're already oriented of maternal and child nursing. So class, take note that in the healthcare field, when I talk about abortion, abortion does not necessarily mean na pumupunta po tayo kung saang clinic tapos illegally nagpa-abort. Okay? So when I talk about abortion, in your maternal and child nursing, as discussed to you perhaps, when I talk about abortion, it's any termination of pregnancy. When I say abortion, it's termination of pregnancy before the age of viability. Okay, before the age of viability. And if I talk about age of viability, ilang weeks na pregnancy po yung age of viability natin? When I talk about age of viability, ilang weeks po yung kinoconsider natin na age of viability ng fetus? Yes, you can use the chat. Emre, ilang weeks daw?
24 weeks po.
Okay, 24. Yes, how about others? Any idea on it? Ilang weeks po yung kinoconsider natin na age of viability? Okay, somebody is saying 20. So class, more common between international and local, mas common po natin ginagamit yung 20 weeks as the standard of the age of viability. Okay, so pag sinabi nating abortion, it's any termination of the pregnancy before 20 weeks. In other words, hindi kailangan pumunta ng clinic tapos pinalaglag yung bata. Diba, kadalasan yun yung iniisip nating abortion. Okay, so if you would look at the definition here on screen, it says expulsion from the uterus of the products of conception before it becomes viable. Another definition is that it's a premature stoppage of a natural or pathological process. So abortion kasi abort, no? Parang pinigil po natin. So it's a premature stoppage of the natural or pathological process. Now, in the healthcare parlance, we need to know what are the different types of abortion. So you will encounter these different types of terms. Pag sinabi ko pong complete abortion, kumpleto po siya. No? Lumabas po lahat. Ibig sabihin yung placental fragments, ibig sabihin yung fetus, ibig sabihin yung mga components ng conception. All products of conception went out of the vagina. Okay? Went out of the birth canal. Pag sinabi ko pong birth canal, vagina pong tinutukoy natin. So kaya nga po tinatawag po siyang complete abortion. Now, another term to differentiate with complete abortion is of course your incomplete abortion. Pag sinabi ko pong incomplete abortion, may mga retained parts po siya. May mga retained parts po siya. In other words, lumabas si baby, yung placenta na iwan. Or lumabas si baby, lumabas yung placenta, pero may part ng placenta na naiwan. Okay, may mga parts ng placenta na naiwan. Pag magkaganon guys na may naiwan, palagay nyo, between the term complete and incomplete abortion, sino po sa kanilang dalawa yung may mas risk for bleeding? Will it be the complete abortion or the incomplete abortion? Sino po yung high risk for bleeding? Letter A or letter B? So tama, no? It will be your incomplete abortion. Okay? Plus incomplete abortion, mataas pong risk yan for bleeding. Okay? Now, you have the term naman habitual, no? May term naman tayong habitual abortion. Pag sinabi nating habitual class, hindi po yan habit na computer. Halimbawa, habit nating mag-computer, habit nating mag-social media. Hindi po ganun, ano? Pero habitual po siya kasi spontaneous na nagaganap. In other words, the patient did not take any drug. There was no intervention done, but then bawat pagbubuntis nalalaglag. Okay? Bawat pagbubuntis hindi nagiging successful. That is what we meant by habitual abortion. Okay? Class, pag sinabi po nating habitual abortion, kapag tayo po ay makaka-encounter ng mga pasyenteng habitually may abortion, halimbawa 3 or 4 na beses na po siyang nagkaka-abortion, usually may underlying medical cause po yan. Okay? Meron po tayong underlying medical cause. Now, pag sinabi ko pong underlying medical cause, isa pong underlying medical cause ng inyong spontaneous abortion, isang tinatawag nating APAS syndrome. May tinatawag po tayong APAS syndrome. Okay? Yan po kadalasan kung halimbawa yung pasyente magsasabi, nurse, ilang beses ko na talagang na-try, ilang beses na kaming nag-try ni mister, nagagawa ng bata, kaso hindi. After 12 weeks, lumalabas. Okay? Tapos after 20 weeks, yung pangalawa kong pagbubuntis, lumabas. Hindi po talaga nagiging successful. So if that's the case, guys, one thing that we do is that you have the blood test for the APAS syndrome that is being referred to as APAS panel na lang rin. Okay? So it's a panel of blood test to test whether may APAS syndrome itong pasyente natin. Okay? So yan po ang isa sa mga dahilan. Okay? Other than that, may mga dahilan din pong kagaya ng incompetent cervix. If you can recall in your maternal and child nursing, may tinatawag po tayong incompetent cervix. So ibig sabihin, the cervix is unable to hold the fetus itself. Okay, the cervix is unable to hold the fetus itself. Di ba, class, if you will recall the anatomy of the woman's body, pardon my drawing, so if this is your uterus, the opening here of your uterus is referred to as your cervix. And then from that, class, will be your vaginal canal. That will be your vagina. No? So class, dapat yung cervix natin during pregnancy, will it be open or closed? Ang cervix natin during pregnancy, open nga ba siya dapat or closed? Students, magiging open nga ba si cervix during the pregnancy or closed siya dapat? Anybody on chat? Okay, so closed siya dapat, Okay, closed siya. Or somehow intact siya na mahuhold niya si baby. But in the case of incompetent cervix, as the term implies incompetent, ibig sabihin hindi niya kayang mag-close, nag-o-open siya. So anong nangyayari? Nalalaglag yung bata. Okay? So those are common problems in habitual abortion. Now, punta muna tayo sa mga actual settings sa hospital. Class, pagtatanungin tayo, is abortion legally allowed? Is abortion legally allowed in the Philippines? The answer for that is, pwede bang magpa-abort dito sa Pilipinas? Halimbawa, sasabihan kita, uy Ralph, Kimberly, hali kayo, assist nyo muna ako sa abortion, ako yung doktor. Dapat po ba tayong mag-assist? The big answer there is no. Hindi po tayong dapat mag-assist because that would mean your license. Because in the Philippines, abortion is not allowed. Now, here comes a patient in the ER, May pupuntang pasyente sa ER. Itong pasyente, class, pale, weak. Pagkatapos, alam mo na pregnant siya. Pregnant po siya for 15 weeks. Pagkatapos, ang sabi po sa inyo ng partner niya, partner kasi hindi pa sila kasal. So, sabi ng partner, meron daw vaginal bleeding. Pagkakita mo, class, ng diaper, kay kadalasan yung mga babae, di ba, pag heavy bleeding, nagda-diaper na yan. Hindi na yan napkin. Parang may nakita ka, class, na tissues, Parang may nakita kang white tissues. Tissues na mapuputi. If tissues ba, as in combination of cells, parang you're thinking that those are products of conception. Okay? Now, during history taking, kasabay mo yung doktor na confirm mo na itong pasyente pala pumunta sa parang isang black clinic, parang illegal clinic, tapos plus nagpalaglag ng bata niya. Pero 2 days after, tuloy-tuloy ang bleeding niya. In other words, nagpa-abort siya. Pagkatapos tuloy-tuloy ang bleeding niya, pumunta siya ng ER, humihingi ng tulong. Now, sabi natin, abortion is illegal in the Philippines. Tayo yung nurse sa ER. What would we do with the patient? Will we accept the patient and cater the patient? Or will we refuse the patient kasi nga illegal yung abortion sa Pilipinas? Tutulungan ba natin yung patient or i-refuse natin? Kasi illegal nga yung abortion sa Pilipinas. Okay? Very good. I can see good answers. You need to cater the patient. Okay? You need to cater the patient. You need to help the patient. Okay? Kung baga, guys, we could not do abortion. Hindi po tayo nagdudo ng abortion. Pero once they seek consult in the hospital, pag ganyan po yung cases, tulungan natin yan. Kasi kailangan po yan ng medical help. Okay? Sir, paano? Kasi anti-abortion ako, I am from a very committed family. Plus, pag magkaganon, wala pong pumipilit sa inyo. Paulit-ulit ko pong sinasabi, if you are uncomfortable in assisting in the case, you could just inform your head nurse and then another nurse could assist in the case. Okay? Kasi baka sabihin nyo, sir, hindi po kaya ng religious belief ko mga ganyan. Okay? It's okay. We respect that. But then that patient needs to be taken care of. Okay? That's one thing that you need to remember. Why am I giving you this example? Many times already I've encountered such cases. Many times already I've encountered such cases. Pero ang pinagkaiba lang dito sa sinabi kong kwento is that dito na-confirm na abortion. Sa kadalasang mga cases class na nai-encounter namin, ayaw talagang mag-confirm ng abortion. Okay? They don't want to confirm that they had abortion. They don't want to confirm that they have taken a tablet for abortion to occur. Ang sasabihin lang nila, kadalasan, no, I have encountered 1 or 2 patients who would just say na, "Sir, when I was urinating in the CR, suddenly I felt that there's a big lump that fell in the CR, and that in the toilet bowl. That lump that they're referring to is already the fetal materials or the products of conception." So rarely will they confess that they have taken any medication and they have done instrumentation to that effect. Okay, but then we still help these patients. And mind you guys, when you are dealing with this patient, it's not only that you're helping them physically, you need also to address their mental health. No? Psychological problems also are very common among these patients. Now, let's go towards other terms. Other terms po natin dyan is induced. In other words, kagaya ng example ko, it's either that the patient has taken a medication or instrumentation was done. It's either na nag-take po siya ng medication or may instrumentation po tayong ginawa. Okay? That's induced abortion. Now, another thing is inevitable. So pag sinabi nating inevitable, parang mahawig mo siya sa habitual. Ang pinagkaiba lang ng habitual, 3 or more na siya. Pag inevitable class, nag-bleed siya, nag-cervical dilation, wala naman silang ginawang intervention, parang kusa lang talagang nalaglag. Okay? Kasi nga may underlying medical reasons. So pag tatanungin kayo kapag spontaneous siyang uri ng abortion, okay, your spontaneous abortion is also your inevitable abortion. Masasabi lang siya nating habitual kapag 3 or more na. Okay? Masasabi natin siyang habitual if 3 or more na. Now, infected. Infected po siya kapag may genital tract infection po tayo. In other words, when you have your sexually transmitted diseases. Okay? That's why I would always remind my students of the letter B in your ABC. Please be faithful with your partners. Be faithful with your partners. Yung STD po kasi madali pong mag-spread. And then once you have STD, especially you have HIV and AIDS, that will be the time that patients will be saying na, sana kung pwede lang akong magbago, hindi na po ako mag-multiple sex partners. Okay? Now, I'm not telling you to engage in premarital sex. Sex is a responsibility. So, hindi po advisable yung premarital sex. You know that, no? By religion and by the values that is being taught to you. But if you are already sexually active, please practice your ABC, abstinence, be faithful, at saka use of condoms. Okay? Abstinence, be faithful, and then use of condoms. Why am I giving this advice? I am made aware that people your age are already becoming sexually active also, and then a lot of my students has been sexually active already. So please lang, be abstinence again, be faithful, and then use of condoms. By the way, I'm also aware that a lot of students are already using pills for the sexual contact that they had. Please be aware that pills would also have their side effects. No? Pills would have their side effects, and pills could not save you from sexually transmitted diseases. Pills could not save you from sexually transmitted diseases. And mind you, ilang years nga ba class yung incubation period ng HIV? How many years is the incubation period of HIV? Any idea? Up to how many years yung incubation period ng HIV? Sige nga, any idea lang. Hula-hula lang. Okay? Hindi lang po basta-bastang 1 month. Hindi lang po basta-bastang 5 years. Higher. Okay? Tama po siya, 10 years po tayo. Okay? 10 years po tayo. Hanggang po 10 years yung incubation period ng ating HIV. So pag sinabi ko pong 10 years, yung incubation period ng 10 years ng HIV, it means that it is possible that you have acquired HIV right now with your sex partner, but then for the next 10 years, you will not be feeling anything. Okay? Wala kang mararamdaman sa katawan mo until after another 10 years na baka bababa na yung immune system mo, AIDS na yung nararamdaman. So, sino yung i-blame mo? Okay? Sino yung i-blame mo? Okay? Tama, nakakahawa ka na without knowing. and then your immune system is already being damaged. That's why A, B, and C. Regardless of your sexual orientation, please A, B, and C. Okay? On the side, this is not on the topic, pero alam niyo maraming nurses akong kakilala na nagkaroon po ng AIDS, no? Maraming nurses po akong kakilala na nagkaroon po ng AIDS. I'm not saying that nurses are prone to AIDS, pero it so happened lang siguro nakakilala ko sila. And you know what? In the last minutes of their lives, anong palaging sinasabi? Nurse po ako, ano? Sayang, alam ko din naman kasi on how to prevent it. However, hindi ko po ginawa. Okay? So, class, I don't want you to regret the same. Ha? So, hindi po yan ang values na tinuturo natin sa inyo. Pagkatapos, I'm not in the line also na magagalit na or what, ano. Pero payo lang po yan sa inyo. Please understand na that's also for your future later on. Now, going back to the discussion that we have, when I talk about missed abortion, pag sinabi ko pong missed abortion, so retention po tayo in the uterus. Okay? Products of conception are retained in the uterus and the fetus could be dead already for at least 8 weeks. Ibig sabihin, class, namatay yung fetus sa loob, hindi na po gumagalaw, tapos late na po na-discover. In other words, no, missed abortion po siya kasi nga hindi po lumabas. Now, if that fetus, class, if the dead fetus will stay in the uterus, is that okay or is that harmful to the mother? Magiging harmful ba yan sa mother or okay lang na may dead fetus po tayo? Very harmful po yan, ha? Pwede pong magka-infection ng mother because of that. Okay? Then you have your septic abortion. Pag sinabi ko pong septic abortion, may serious infection po tayo ng uterus. Pag sinabi ko pong serious infection ng uterus, usually class nanggagaling din yan sa STD. Remember, your STD is an ascending type of infection. Ha? Pag sinabi ko pong ascending type of infection, unang-una po sa vagina, pagkatapos aakyat yan ng cervix, tapos aakyat na po ng uterus. Okay? And that would entail that your patient would have pelvic inflammatory disease, no, or your PID, which is also life-threatening on the part of the uterus. Now, pag sinabi kong STD, take note, hindi lang po babaeng dapat mag-ingat dito. Ha? So boys, kasabay din tayo dyan. Okay? That's why if your wife later on would become pregnant, please be responsible also to take care of your sexual health. Okay? Considered as foreign body po once na may maiwan during abortion. Yes, tama. No? It's considered a foreign body that needs to be removed. Okay? Spontaneous. So another word for spontaneous is natural. Pag sinabi ko naman pong therapeutic abortion for medical conditions, therapeutic abortion is not very common here in the Philippine setting. But when I talk about therapeutic abortion, halimbawa yung fetus may malformation. Or halimbawa ang fetus was found to have abnormalities or genetic abnormalities. Di ba, if you can recall in your MCN, during po the life of the fetus, meron po tayong tinatawag na amniotic fluid testing. Ano? Pwede po tayong mag-test ng amniotic fluid at pwede din po tayong mag-test ng chorionic villi. Okay? Pwede din po tayong mag-test ng chorionic villi. So class, in your amniotic fluid at saka your chorionic villi sampling, we will be able to know if there are genetic problems that are present among your fetus. And then it is the time we're in, no, kapag sa Western countries tayo, sinasabi na ma'am, ito po yung mangyayari. If you will continue with the pregnancy and then if this child will be born, the child will have this genetic disorder. Then if you are in the Western countries, the couple could decide, will they go on with the pregnancy or shall they terminate the pregnancy? So that's what we refer to as therapeutic abortion. Yes, may nagsasabing ectopic pregnancy, ano? So class, when I talk about ectopic pregnancy, I think the term for the removal kasi of ectopic pregnancy is not abortion. No? But sige, let's discuss ectopic pregnancy. When I talk about ectopic pregnancy, it's pregnancy outside of. Pag sinabi kong ectopic pregnancy, outside of uterus. Okay? Outside of the mother's womb. Tama. So class, where is the common site of your ectopic pregnancy? Saan po yung common site ng ectopic pregnancy? Ano pong bahagi ng katawan po yung common site ng ectopic pregnancy? Yes? Okay, very good. That will be your fallopian tube. Ha? The common site po for ectopic pregnancy is fallopian tube. So, pag sinabi po nating ectopic pregnancy, okay lang po ba na i-terminate yung ectopic pregnancy? Okay lang po ba na i-terminate yung ectopic pregnancy? Okay? Alam mo, in ethics, the question will be, is there already life is there already life, no? Okay? Kung kaya, the common question that we encounter in ethics is, when does life really begin? No? When does life really begin? Others would say that by the time that the sperm and the egg, by the time that the sperm and the egg will meet, life already begins, no? By fertilization. Others naman would say that it is by the time that the embryo is already formed. Okay? Others naman would say that it is by the time that the heart is already pulsating. Okay? So, ang pulsation po ng heart, audible na po yan at 12 weeks. No? It's audible already at 12 weeks of pregnancy. Now, if that's the case, class, in ectopic pregnancy, baka tanungin, ano, is it ethical to remove the ectopic pregnancy? Yes, of course. No? It's very ethical. One, if that pregnancy, students, is in the fallopian tube, it will not be able to reach the age of viability. Because remember, your fallopian tube does not expand. Okay? Your fallopian tube does not expand. Pangalawa, once po mag-stretch ng konti yung fallopian tube, and once po it will rupture, it can threaten the life of your mother. It can threaten the life of the mother. And that would lead, class, to bleeding, hemorrhage, okay, which is life-threatening. There is already life, however, it can threaten the life of another human. Therefore, it's yes. Yes, pwede po siyang i-remove. Okay? But then, class, may mga ectopic pregnancy, I've read of case studies wherein the ectopic pregnancy is really outside the uterus, outside also of the fallopian tube, as in sa labas po talaga siya ng female reproductive system. Okay, kung baga yung fetus po nag-grow outside the female reproductive system. Okay, so tingnan yung mga ganon. Merong pregnancy, class, that was able to be carried to term, na yung anak po parang nandyan lang po talaga siya sa abdomen. Literally po katabi yung mga intestines natin. Okay, you can read on cases like that, but those are very few cases, no? Okay, bilang siguro yun sa buong mundo. Okay, now, you have another term, threatened abortion. Pag sinabi ko pong threatened abortion, so it's vaginal bleeding wherein the cervix is not dilated. Okay, threatened lang po siya, vaginal bleeding, cervix is not dilated. Naglagay po ako ng note dyan that it's less than your inevitable abortion. Ibig sabihin, mas malala yung inevitable abortion compared to your threatened abortion. Okay? So, that's it. Pagkatapos, now, the argument, no? Napakaraming argument. In fact, it's a very good topic for debate still up to now. So, whether you support abortion or you are not supportive to abortion. So, those who are supportive of abortion are talking about the focus on saving lives. No? Yan po yung mga contra-abortion. So, sinasabi po nila na hindi po pwedeng magpa-abort kasi nga life po yun. Pagkatapos, sinasabi nila using the principle of double effect, hindi daw po talaga beneficial yung abortion. Pagkatapos daw dapat unselfish love tayo and solitude. So ibig sabihin, kahit ano man ang maging outcome daw ng pregnancy, dapat marunong daw tayong magmahal kasi that's a gift from God, no? That's the argument. And then, class, it's the recognition of life and then the genetic role of the offspring. Whereas the pro-abortion, no? So kadalasan, class, ang argument pala, no? The common argument that you can hear is pro-abortion is pro-choice, whereas contra-abortion is pro-life. That's one of the common standpoint that they had in the current era. So ano naman ang sabi ng mga pro-choice or pro-abortion? It's to safeguard the life of the mother. It's the right of the woman. It's the expression of freedom. And fetus is not yet a human person. Okay? Saan pong tama sa kanilang dalawa? Hindi ko po sinasabing may tama at mali dyan. Okay? Pinag-aaralan po natin kung ano pong pwedeng maging standpoint ng isang pro-life at saka ng isang pro-choice. And when you're dealing with your patients, class, you go back on the ethical principles still. You go back to the ethical principles. I don't know, maybe by the time that you will graduate and by the time that you are already practicing nursing, abortion might be already legal in the Philippines. Okay? Pero magkaganon, class, kung ano man yung magiging direction ng abortion sa country natin, I hope that you will not make it, and I hope that the future generations would not just make it as an option to end anything that they would want. No? So sana hindi po ganon, ano? So, isipin po natin ganon. Sige. Where are we? So that's for abortion. The next one is rape. No? The next one is rape. Now, for rape, it is an unlawful activity with sexual intercourse carried out forcibly or under the threat of injury against the will of person, or somebody who is incapable of consent because of mental illness, deficiency, intoxication, unconsciousness, or deception. Okay? Now, rape. Common pa rin talaga yung rape sa society natin, ano? And then you could not avoid the thinking that parang biniblame pa minsan yung victim. Have you heard of that? Wherein it's sometimes the victim who is blamed why daw the rape happened. No? Kadalasan sinasabi, ayan kasi nagahasa, kasi nga na naka-short, kasi nga na naka-two-piece, ayan tuloy nagahasa. Ano? So, yes, dahil daw sa damit, di ba? It's a very common notion that is still present in our community. We don't want those notions, and as nurses, no, yes, victim blaming, no. So we need to be aware that these are unlawful activities. Okay, so pag sinabi ko pong unlawful activities or in sexual intercourse forcibly, halimbawa asawa ko si person A. Tapos asawa ko siya, ha? Siyempre asawa ko, kasabay kaming naninirahan sa isang bahay. Halimbawa, pagdating ng asawa ko sa trabaho, niyaya ko siya, sabi ko, let's have sex. Pagkatapos, if my wife refused to have sex, can I be accused of rape? Kapag tinuloy ko, mag-asawa kami, kasal kami, legally married. Pagkatapos, I forced her to have sex. Can I be sued? Yes. It's still considered rape. How about if, picture this situation. Wag naman sanang mangyari, pero I'm hearing this. Ano? Picture this situation. Person B is 21-year-old male. Then, person B had sex with person C. Person C is 16-year-old female. Can I consider it rape? Can I still consider it rape? Yes, yes. Because it's hindi pa po siya age of consent. Hindi pa po siya age of consent. Paano pag sinabi, yes, age of minority pa siya. Paano pag sabihin naman ni person B, she voluntarily opened her body to me and then voluntarily binigay niya naman lahat sa akin. Pwede pa rin ba yon? Pwedeng dahilan ba yon? Hindi pa rin pwede. Okay? So kindly take note of that. Kindly take note of that. Now, another thing, halimbawa, may baliw, May baliw. So, pag sinabi nating baliw, halimbawa tapos nalibog yung isa, si person B naman nalibog kasi yung baliw daw pagkaganda-ganda. Tapos ginahasa niya. Pwede ba 'yon? Okay, that's still considered rape. Because that person, in fact guys as nurses, hindi tayo gumagamit ng term na baliw Mentally incapacitated will be the appropriate term. Hindi po natin dapat ginagamit ang term ng buang, di ba? Buang is common also, no? So buang, baliw, hindi po dapat. Okay? Sige. So those are things. Or halimbawa, nag-night out. Pagkatapos, medyo tipsy ka kasi nga nag-alcohol ka. Pagkatapos may nag-attempt humalik sa'yo, hinalikan mo naman, tapos may nangyari sa inyo. Pwede ba yung makonsider na rape? Pwede din ba yung makonsider na rape? Yes, class. No? Pwede pa rin siyang makonsider na rape. Okay? But then, when I talk about rape, I'm so sorry. I know some of you might know victims also of this. It is also a very sensitive topic. No? So, when we talk about rape, when an individual is intoxicated, when an individual is unconscious, those are all considered rape. Or pag sinabi, halimbawa, deception. Pag sinabi, uy, pare, inom ka nito. Pagkatapos, kasabay pala nung inumin na yon parang may drug, wherein pag ininom mo, parang makakatulog ka, that's still considered rape. Tsaka may nangyari sa inyo, rape po yan because it's an act of deception. Okay? What I was about to say earlier is that although rape is something that we are not tolerating, pero you know what? I've heard of many cases na wherein victims of rape would actually opt not to report the rape. Bakit po daw? Their reason daw is that napakabagal po ng justice system. And then by the time po that they would want to move on, halimbawa, pag nagkaso sila, pagkatapos they're about to move on na after 1 year, that will be the time pa lang na nagsisimula yung proseso. No? Nagsisimula yung proseso ng legal system. So, ayun, may mga narinig akong cases na ang lungkot pakinggan, ano? Sa sinasabi, alam nila na rape sila pero wala na silang magagawa. Parang gusto na lang nilang mag-move on. So as nurses, remember, we advocate for these people. Okay? We advocate for these people. Okay? I have read here in the comment, no? Kaya nga po sinasabi na basura yung justice system. Okay? It might not be professional for me to comment on that, but those are also the common notion that we can hear in the society and the community. Okay? So, ano nga ba? I was about to say earlier, as nurses po, we need po to advocate for these people. Okay? We need to advocate for these people. Pag may kakilala po kayong rape victim, please right away ipa-report. Ha? Hindi po natin pwedeng sabihin na sige, maghintay tayo ng 3 days kung saan ubos na yung luha mo bago tayo mag-report ng rape. Okay? Remember that for the case of rape to be proven, a lot needs to be collected, no? Marami po tayong evidences na kailangan po nating i-collect. Okay? If you are abroad, may mga special training na po ito para sa mga nurses. I forgot the term. I think it's more of paramedic training or maybe training on abuse and violence. So, included in this training is that how would you collect specimens? How would you collect specimens? So, hindi po pwede. Okay, question muna. Halimbawa, may rape victim, pumunta sa'yo sa ER. Tapos napakadumi, no? Gusot-gusot yung mga damit, tapos yung underwear, may mga punit. What would you do? Will you change the patient to a comfortable clothing and bathe the patient para komportable siya? Or wait muna for a medical legal officer to examine the patient? Okay? So, ano pong gagawin natin? So, you need to wait for a medical legal officer to examine the patient. Ha? Minsan kasi parang sinasabi niyo, uy, kawawa naman, kailangan ko tong linisan, no? Kailangan. So, you don't do that. Or else, class, you will tamper the evidence. Very good. That's the term, ha? You will tamper the evidence. Kahit po yung nails ng pasyente, hindi po natin pwedeng linisan because during rape, if there was self-defense that was done, the tendency is that baka po na-scratch ng pasyente yung back ng pasyente or yung tissues ng pasyente, ng rapist, I mean. And then class, from that, you will be able to identify who the rapist is. Okay? So mga ganon, no? Mga nursing interventions niyo po yan. And anything that is collected from the rape victim needs to be bagged. Pag sinabi ko pong bag, dapat po naka-plastic po siya, selyado po siya, labeled po siya kung saang bahagi ng katawan nakita. So, halimbawa, may mga hair kayong nakita, huwag niyong i-assume na ay nagka-hair fall siguro yung pasyente kasi nga ginahasa siya. Baka po hair po yun ng rapist. Okay? Baka hair po yun ng criminal. So you would need to address it, no? So you would need to facilitate that those will be collected. Okay? So yan po yung rape. So if you will be asked ethically, is rape ethical? It can never be ethical. Is rape ethical? It can never be ethical. But the next ethical question is that, can we allow abortion for rape victims? No? Can we allow abortion for rape victims? So class, abortion, no, it's not allowed. But class, if your patient will be able to seek medical help right away, there is what we refer to as your morning after pill. Okay, may tinatawag po tayong morning after pill. As the term implies, morning after pill, ibig sabihin matapos po siyang maganap, matapos po mangyari yung episode ng rape, pwede po siya nabigyan ng isang tablet and then that tablet may stop your fertilization. Okay? But that is to be determined by the physician. Hindi po pwede na tayong nurse yung mag-recommend kasi po may mga further assessment muna before we could give that to your patient. Okay? So that's it. Now, let's have the term euthanasia. Pag sinabi ko pong euthanasia, what's the word that comes into your mind? Anybody nga? Euthanasia. Euthanasia. Pag sinabi po nating thanatos, di ba? Thanatos is death, no? Thanatos is death. So we have the term euthanasia. Yes, mercy killing. Very good. That's the common term we associate with euthanasia. Mercy killing. So pag sinabi nating euthanasia, we oftentimes associate it with easy death. Not easy death. It is easy death, it is mercy killing, regarded as a merciful release from an incurable and prolonged suffering. Okay? So release daw siya from incurable and prolonged suffering. So ano pong argument dito usually, ano? May mga doctors po kasi, especially Western countries na mga cases, may mga doctors who are advocating for mercy killing. So ano pong sinasabi nila na ano nga ba? Sabi nila, let's end your suffering now. Okay? Tapos i-contact mo lang daw sila. They will assist you in mercy killing. One book in ethics, the Book of Timbresa, has shared one case in the US wherein there was a doctor, I forgot the term of the doctor, Korvakian or something like that. The doctor is actually advertising mercy killing during his time. No? Pagkatapos marami po siyang naging kliyente. So yung mga tao po halimbawa na depressed or mga tao po halimbawa desperate would just go to this doctor and then this doctor would assist him to end his or her life. Okay? And that became a big ethical issue. Now, it is the art of practice of painlessly putting to death a person suffering from unbearable or distressing disease. Okay? Di po yan pwede sa Pilipinas. Okay? Yes. Now, there are different types of euthanasia. So you have your voluntary, you also have your involuntary, and then you have your active, and then you have your passive euthanasia. Pag sinabi po natin voluntary, involuntary, as the term implies, voluntary, ibig sabihin ginusto ng pasyente. Involuntary, ibig sabihin ibang individual po yung nag-decide. Okay? So class, pag sinabi po natin involuntary na euthanasia, sabi nga ng iba, parang in-equate siya sa death sentence. Parang na-equate siya sa death sentence kapag involuntary euthanasia. Now, if I talk about active euthanasia, it involves administration of products. So pag sinabi kong administration of products, in other words, may binibigay kang gamot para mamatay siya, may binigay ka na produkto para mamatay siya. Active euthanasia, meaning you did something. Okay? You did something. Other textbooks would say this is the act of commission. Pag sinabi kong active euthanasia, tinatawag po siya nating act of commission. In other words, you committed something. You committed something. Okay? Pag sinabi ko namang passive euthanasia, withdrawal of support or means. Halimbawa, pag itong gamot, kaya halimbawa medication A will be able to help in the breathing of the patient. And then you have decided, sige, stop na natin yung medication A. Wag na natin gawin yan, yung medication A na yan. That's withdrawal of life support or means. Okay? Yes, intentionally letting a patient die. Halimbawa, hindi mo na siya bibigyan ng pagkain, hindi mo na siya bibigyan ng nutrients. Tinatawag po natin yung act of omission. Act of omission. In other words, you omitted something. Okay? Nag-omit ka ng something para hindi po matuloy. Okay? You omitted something para na hindi na po siya mabuhay. Now, there are different combinations. So, pwede siya maging voluntary, active, voluntary, passive, involuntary, active, involuntary, passive. Okay? Those are the different combinations of your euthanasia. Now, so, when we talk about this euthanasia, the question there, what that sets in is that, is it ethical? Is it legal? No? So, class, of course, it's not ethical, it's also not considered legal. Okay? But later on, you will encounter different situations wherein we withdraw life support to the patient. Okay? For example, you have your DNR, then you also have your do not resuscitate, no, or the like. We will be discussing that in a little while. Okay? So pero pag tanungin tayo if we support euthanasia, it's not part of the nursing profession to support euthanasia. Hindi po yan part ng nursing profession to support euthanasia. We have other terms that we encounter, but then it's not euthanasia that we are supporting. So, let's talk about end-of-life care. So, class, pag sinabi ko pong end-of-life care, ang usual term po na may encounter natin dyan is that, what do you call the type of care at the end of life? Something that starts with letter H. Ano pong tawag natin sa care at the end of life? No? End-of-life care. Okay, very good. No? May tinatawag na po tayong hospice care. Okay, hospice care. Now, when I talk about hospice care, class, the main intent lang naman po ng hospice care is to provide your patient with what we refer to as dignified death. Okay, class, the main goal of your hospice care is to provide your patient with dignified death. Okay? Yan po yung purpose ng hospice care. Now, when I talk about withholding and withdrawing medical interventions, it can range from minor to complex. Pag sinabi ko pong minor, halimbawa po ng minor, ano nga ba? So class for the minor, you will have an option to, for example, withhold food, withhold nutrition to the patient. Whereas class pag sinabi kong complex, that could be the mechanical ventilator. Pag sinabi kong mechanical ventilator, I hope you're familiar with the machine. Nakita niyo po yung machine na parang tumutulong na huminga yung pasyente. Okay? Yung machine po na tumutulong na hihinga. Mechanical ventilator po tawag dyan. You will encounter more of that in medical surgical nursing. Tapos plus sa complex, meron din tayong different kinds of medications that would support the heart of the patient. So those are referred to as complex medical interventions. Now, bakit po pumapasok sa kwento itong withholding and withdrawing medical interventions? No? So why or why? That will come into the time class wherein the benefits of withholding it are already more than the risk. No? Bakit? Life-sustaining therapies po kasi may prolong the suffering at the cost of decreasing the patient's quality of life. Okay? May mga life-prolonging measures tayo. Halimbawa po, may mga medications po tayo. May mga medications tayo that could increase the blood pressure of the patient. Now, these medications that increases the blood pressure of the patient can increase it. Kaya nga sabi ko, can increase it. But the question is the patient conscious? Pagkatapos, after halimbawa na 30 days na siya sa medication na yan, ano po yung magiging outcome ng pasyente? Okay? Gising pa nga ba ang pasyente? Buhay pa nga ba itong pasyente? Okay? Those are the questions that are being asked. So that's why the family would sometimes opt na, sige, stop na natin yung mga measures. Pagkatapos, isang example po dyan is your CPR, your cardiopulmonary resuscitation. Plus the survival po in CPR, as our textbook would say, according to one research, is less than 18%. Okay? Now, pagkatapos, after you've survived a CPR, the tendency class that your quality of life will be good after that is very minimal also. No? So, kadalasan sa hospital, may ma-encounter kayong pasyente. Halimbawa, 3 beses nang nag-arrest. 3 beses na class nag-cardiac arrest. 3 beses na na-revive ng CPR. That will be the time wherein the doctors actually will be talking to your patient's family. If what will be their decision in case that, excuse me. So, what will be their decision in case that another cardiac incident would happen? Okay, so dyan na po pumapasok yung mga DNR, etc. Okay? So, bakit nga? Bakit? Because it goes back to the quality of life. Meron nga po tayong tinatawag na term na persistent vegetative state. Okay? Di ba kadalasan sinasabi pag malala yung sakit ng pasyente, parang sinasabi, ay vegetable na yan. Or sinasabi, ay gulay na yan. Hindi po yan gulay na makakain. Yung ibig sabihin po natin is that parang yung pasyente, alam natin na gising siya, pero the opportunity for the patient to have a good quality of life and the opportunity for the patient to resume normal functioning is very minimal already. Okay, so kung kaya, there are options for withholding and withdrawing medical interventions. So the justification for that is that the patient's quality of life. Okay? Now, isa po dyan is what we refer to as your DNAR. In the past, there was the term commonly referred to as DNR. Ang common pong ginagamit na term is DNR, which is do not resuscitate. Pero po ang common na ngayong pinalit is your DNAR. So we have your do not attempt resuscitation. In my hospital experience, what we do is that we always educate, no? We always educate the patient. We always ask the patient and the family what would they want to stop or withdraw. So pag sinabi ng pasyente or ng pamilya mag-DNAR tayo. So class, kina-clarify namin ano po yung ipapa-do not ninyo. Compressions lang po ba? Pati po ba mga gamot? or pati po nga ba yung intubation? Yung intubation, nakikita nyo yun sa mga movies na nag-i-insert sila ng tubo through the airway. That's what we refer to as intubation. Okay? May mga pasyente akong na-encounter, guys, na ayaw na lang nilang magpabigay ng gamot pero gusto pa nilang magpa-CPR. May mga pasyente din na okay lang sa kanila magpa-CPR, okay lang sa kanila yung cardiac drugs, pero ayaw nilang magpalagay ng intubation or advanced airway. So we've encountered patients like that, no? So dapat tinatanong, ano po nga ba yung hindi niyo po gusto? Now, pag sinabi nating DNR, tulad ng na-emphasize ko sa inyo dati, when I say class DNR, in other words, by the time that the patient would have cardiac arrest, no? By the time class that the patient would have cardiac arrest, hindi na po tayo magsi-CPR. Because that's the wish of your patient. That's the wish class of of the family members of the patient. So kung kayo namang mga nurses, dapat po endorse po talaga natin sa incoming shift. At saka endorse po talaga natin, ginagawa nga namin, nilalagay talaga namin sa front ng chart. But yung words na DNAR, para po malaman ng lahat ng healthcare professionals na ito pong pasyente ayaw na pong magpa-resuscitate. Okay? So that's part of your advanced directives. Then meron din pong tinatawag lately na A&D. A&D is allow natural death. So anong pinagkaiba ng DNAR at saka ng A&D? So sa DNR, parang sinasabi walang CPR. Sa A&D po, only comfort measures to manage symptoms related to comfort. Okay? In other words, gusto ng pasyente maging komportable, gusto ng pamilya that the patient will be comfortable while facing death, but they don't want any other measures to be added. So that's what we meant by allowing natural death. Okay? Meron din po tayong tinatawag na MOLST, and then you also have the term POLST. So M kapag medical, P po is physicians. So these are medical or physician orders to life-sustaining treatment. Okay? In other words, yung treatment is parang to sustain life lang and just to make the patient comfortable, but it's not about having advanced measures already to save the lives of the patients. Okay? Now, persistent vegetative state, ano? Ito yung sinasabi ko sa inyo kanina, yung vegetable. So, this is an individual who is unable to recover consciousness and to have awareness of the family. Okay? So, persistent vegetative state. Halimbawa, may mga kakilala ko, no, that if, sabi nila, if they would have PVS, persistent vegetative state, nakalagay na sa last will and testament nila na gusto na nilang i-withdraw yung lahat ng life support measures. Okay, so yun po yung mga nakalagay sa mga advanced directives po, ano, kapag you anticipate already these things to happen in your life. So parang sinasabi na if ever that will happen to them, the persistent vegetative state, they don't want already to have advanced measures. Okay, so those are the things. Now, what else? You also have the term ethics committee. Bakit po napasok yung ethics committee dito? Now, marami po tayong ethical concerns na mai-encounter. And then in the dealing of these ethical concerns, hindi po pwede na isang tao lang yung magde-decide. It needs to be decided by a group of people who have background in medicine, who have background in ethics, and who have background in healthcare. So when I talk about these people, these are people who are supposed to educate the hospital and then the other constituents of the hospital. They are also the one to develop policies with regards to the problematic areas, especially in the death and the dying. And they also act as an advisory consultant to healthcare providers and possibly families. No? So, halimbawa, class, there was a case one time in the US din ito. Ito nga yung naging dahilan kung bakit merong law sa isang state ng US. Yung nangyari po kasi is 3 months na pong nasa machine yung pasyente. 3 months na pong naka-attach sa machine, sa mechanical ventilator yung patient. And then, the family would really want to continue the life support measures. Whereas the medical personnel acknowledge na parang wala nang papupuntahan yung pasyente. Kaya wala na namang improvement sa kondisyon ng pasyente. However, nobody can pull out, no? Nobody can pull out the plug. Kaya sabi nga nila, di ba, who will pull out the plug? Kasi nga, wishes ng immediate family members, na ano nga ba, na i-continue yung advanced life support measures. You know what happened, no? Kung bakit po, paano po na-end yung life ng patient? It was a best friend of hers, no? It was a best friend of that patient who have signified that one time during their conversation, the patient has signified that if ever something will happen to him like that, ayaw niya na pong mag-continue ng life support measures kapag persistent vegetative state lang siya. What was the proof? If I'm not mistaken, it's a text message. No, it's a text message or an email from that patient to a friend, which indicates that if that will happen to him, he does not want advanced life support measures to go on. Okay? And with that class, na-pull out yung plug ng mechanical ventilator, and then the patient was able to rest in peace, kumbaga. Okay? Kasi yun naman yung wishes niya. Okay? If I can share to you one research my student did in the graduate school is that to compare the end of life measures perception of the family and then the patient. You know what? According to that research, this research, by the way, is limited lamang yung applications dito sa locality namin because it's non-random sampling. But anyway, what was found out in the research is that usually the family members would want to opt for life support measures. Okay? Family members po gusto pa ng advanced life support measures, pero yung patient usually ayaw na. Okay? So yan po yung findings ng study na may differences po talaga sa kagustuhan ng pasyente kaysa sa kagustuhan ng pamilya. Okay? So for that reason, is ano pong pwedeng key takeaway ko sa inyo? You need to prompt, okay, especially the old ones that you have, the family members that you have, try to ask them already about their advanced directives. Kumbaga, in case, hindi natin hinihingi, but in case something bad will happen, what do they want? Now, what do they want for themselves? And what do they want for their body? That would actually save you. No? That would actually save you from thinking a lot if what is best for them. Because after all, it is their wishes. Okay? So kasi common talagang nangyayari sa atin na nag-argue whether i-extend pa nga ba yung life ng pasyente or hindi. Okay? You have any questions in mind, my dear students?